Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, imagine this. A lifestyle change. Something as accessible as taking a walk, potentially offering a survival benefit for cancer patients that stands up there with some serious medical treatments. It sounds almost too good to be true, right?
It does,
Yeah.
but that's precisely what's coming out of some truly significant new research. This deep dive is all about a major study looking at how exercise impacts people after they've finished treatment for colon cancer.
Yeah, and we're not talking about just any study here. We're pulling information straight from the top shelf, a key scientific paper in the New England Journal of Medicine, plus a health news article helping, frame it all.
Right, and our mission today is to really peel back the layers on this. We want to understand exactly what they did, what they found, which is incredibly powerful, frankly, and importantly, what this means. Why is this study being called the gold standard?
Let's start right there. The study itself is called the Challenge Trial, or CO.21. And you use that term gold standard. What does that actually mean in research, and why is it such a big deal here?
Well, it means this is a phase 3 randomized controlled trial, and that's basically the strongest scientific tool we have for figuring out if something actually causes an outcome, not just if it's linked.
How does it do that?
So in this kind of study, participants get assigned completely by chance, like flipping a coin to different groups. Randomization, that's the key. It helps make sure the groups are really similar at the start.
Okay.
So if you see a difference later on, like better survival, you can be much more confident that the thing you tested in this case, the exercise program, is what actually caused it.
Got it. So causation, not just correlation. That's huge. Who were the people in this trial?
Yeah, they enrolled 889 patients. These were folks who'd had successful surgery for treatable colon cancer, specifically stage 3, or what's called high-risk stage 2.
Okay.
And importantly, they'd all recently finished their adjuvant chemotherapy. That's the chemo you get after surgery to try and prevent the cancer coming back.
And this wasn't just in one hospital, was it?
Oh, far from it. It was a massive international effort. We're talking centers across Canada, Australia, the UK, Israel, and the US,
Wow.
which really helps make the findings more, applicable generally. And it had significant funding, too, from groups like the Canadian Cancer Society. Shows how important people thought this question was.
Okay, so nearly 900 patients, finished chemo, randomly assigned. What were the two groups they were split into?
Right, so you had the exercise group. These patients got put into a structured 3-year exercise program, and it wasn't just like, go exercise, it came with real support. They got a certified physical activity coach.
A coach. Okay, that sounds pretty involved. More than just getting a leaflet. What did that look like?
Yeah, the goal was to significantly boost their physical activity, mostly aerobic stuff. The coaching was quite hands-on at first meeting every couple of weeks for the first year.
Okay.
Then it tapered to monthly support for the next 2 years. They recommended things like brisk walking, maybe 45 minutes several times a week. And they even had supervised sessions early on to get people going safely. Really about building a habit.
Makes sense. And the other group, the comparison.
That was the health education group. They got general health info pamphlets, materials promoting activity and healthy eating. But no structured program, no personal coach, none of that regular contact. Sort of passive info versus active support.
Active support versus passive info.
Got it.
And how long did they follow these folks to see what happened?
So the exercise program itself ran for 3 years, but they tracked the outcomes for much longer. The median follow-up time was almost 8 years.
8 years, that's a good long look.
Exactly. Crucial for cancer studies where things can happen years down the line.
So what were they actually measuring over those 8 years? What were the key things they looked for?
Well, several things. They checked if people actually became more active, often using questionnaires, but they backed that up. They measured physical fitness, too. Things like predicted VO2 max, which is basically how well your body uses oxygen.
Okay. Fitness levels.
Yep. And physical function, like how far someone could walk in 6 minutes, that's a standard test. Plus, they asked patients how they felt about their own physical ability. But critically,
The big outcomes.
the big ones, yeah. Did the cancer come back? Did they develop a totally new cancer somewhere else? And ultimately, did they survive? Deaths from any cause.
All right, the moment of truth. Let's get to the survival data. After nearly 8 years, what did they find? Did the exercise make a difference?
It really did. The results were genuinely striking. The exercise group had significantly longer disease-free survival.
And just remind us, disease-free survival means What exactly?
It means they didn't have the cancer come back, didn't develop a new primary cancer, and didn't die during that follow-up period, basically staying well.
Okay. And how big was that difference?
The exercise group had a 28% lower risk of having one of those things happen compared to the health education group.
28%. Just from the exercise program.
28% fewer recurrences, new cancers, or deaths. Yeah.
Wow. Okay, what did that look like in actual numbers, say, at 5 years?
So at the 5-year mark, the disease-free survival rate was 80.3% in the exercise group versus 73.9% in the comparison group.
That's more than a 6% difference.
It is a meaningful gap.
And what about just living longer? Overall survival, did it help there too?
It did, and the finding there was maybe even stronger. The exercise group had a 37% reduced risk of death from any cause over the study period.
37% lower chance of dying.
Yeah.
That's really remarkable for an intervention like exercise. What were the rates at the end of that long follow-up, around 8 years?
At 8 years, overall survival was 90.3% in the exercise group compared to 83.2% in the health education group.
So still a solid 7% difference after 8 years. It really holds up.
Absolutely. It shows a sustained benefit.
So, okay, the program obviously helped people get fitter and more active. We saw that. And it clearly translated into these amazing survival benefits. But why? Do we know where that benefit came from? Was it just better general health, or did it actually affect the cancer?
That's such a key question. And the study points strongly towards a direct effect on the cancer. The survival advantage seemed to be driven mainly by fewer cancer recurrences. They noted things like fewer returns in the liver.
Oh, okay.
And also fewer new primary cancers popping up elsewhere, like new breast cancers, prostate cancers, even other colorectal cancers.
So it wasn't just preventing deaths from, say, heart attacks because people were fitter.
Exactly. There wasn't a significant difference in deaths from non-cancer causes between the groups.
Right.
It really suggests exercise was doing something specifically against the cancer recurring or new cancers forming.
That's a critical distinction. Wow. Okay, but what about downsides? Were there safety issues asking people who've just been through chemo to ramp up exercise?
They track that closely. And, well, as you might guess, musculoskeletal issues like muscle strains, joint pain were more common in the exercise group, about 18.5% versus 11.5%.
Makes sense. If you exercise more, you might get sore more often.
Right. But the important thing is the study found these were generally manageable. They didn't lead to more serious problems, and the overall rates of serious adverse events were actually similar between the two groups.
So manageable aches and pains, but the huge survival benefits clearly seem to outweigh that.
That is the conclusion, yes.
Anything else surprising? Or things that didn't change that maybe you'd expect?
Yeah, one really interesting point was that this structured exercise program didn't actually lead to significant changes in body weight or waist circumference compared to the control group.
Really? No major weight loss driving this?
Apparently not, which suggests the survival benefits aren't just about shedding pounds. It's likely happening through other biological routes that exercise influences, independent of big changes in body size.
Okay, let's zoom out a bit. The significance of all this. You've hammered home that this is a randomized controlled trial, the best evidence. How big a leap is this from what we knew before?
It's a massive leap. Before this, we had lots of observational studies showing people who happen to exercise more seemed to do better after cancer.
Right, the correlation thing again.
Exactly. Correlation, not causation. They couldn't say, for sure, exercise caused the better outcomes. This challenge trial, it's the first really high-quality, randomized study to nail that down for colon cancer recurrence and survival. It gives us that proof of cause and effect.
In reading the coverage, it sounds like the experts are pretty excited.
Oh, absolutely. You see quotes from top oncologists calling it extremely exciting, Dr. Jeffrey Meyerhart, for instance. And Dr. Julie Greyklow from the American Society of Clinical Oncology basically said this is as high a quality of evidence as you can get, the kind of proof needed to really change practice.
And that point you made earlier that the benefit size is up there with drug treatments.
Yes, let's underline that. That 28% reduction in recurrence or death, the 37% drop in overall mortality. Those numbers are genuinely comparable to the benefits we see with some standard chemotherapy drugs or targeted therapies for colon cancer.
A non-drug approach playing in the same league as powerful medicines.
Precisely. It's a really powerful message.
Which obviously has huge implications. What are people saying this means for actual cancer care going forward?
Well, based on this evidence, you're hearing strong calls for cancer centers and maybe even insurance plans to seriously think about making exercise coaching, this kind of structured support, a new standard of care for colon cancer survivors.
Not just a nice to do, but part of the treatment plan.
Exactly. A proven medical intervention with major survival benefits.
And I'm guessing probably a lot cheaper than those drugs it's competing with.
That's another key point. One of the study authors, Dr. Christopher Booth, called it a remarkably affordable intervention in comparison. He estimated the whole 3-year program might cost a few $1,000s per patient. Still an investment, sure, but
Peanuts compared to many cancer drug costs.
often, yes, orders of magnitude less.
So super strong evidence, big benefits like drugs, relatively affordable. Seems like a win-win-win. Do we have any idea how exercise is doing this? The biology behind it?
That's the next frontier, really. The researchers are actively looking into it. Ideas include better insulin processing, maybe boosting the immune system's ability to fight cancer cells, reducing chronic inflammation, or even changing the environment right around any leftover tumor cells.
Yeah.
They actually collected blood samples during the trial to dig into these exact biological pathways.
Fascinating. But it's not just the biology, is it? The success here also seems to be about, well, actually getting people to do it. The human side. The news article mentioned a patient, Tara Swain Collins.
Yeah, her story was great. She talked about how she chose walking and how having that structure, the coaching, the regular check-ins, it was just incredibly motivating, kept her accountable. She said she felt better physically and mentally, and just knowing she had that appointment helped her stick with it. It really shows that, just knowing exercise is good isn't always enough. That support piece is often critical.
It really brings home that translation issue from evidence to action. There was a quote from Carrie Cornea, one of the study authors.
Yes, he stressed exactly that. Getting people to sustain this kind of change takes belief in the benefits, finding something enjoyable, and crucially, that social support or accountability. And this study, he said, provides that undeniable evidence for the benefits. His quote was something like, "Now we can say definitively exercise causes improvements in survival."
Definitively, exercise causes improvements in survival. That's a powerful statement based on this work. Now, while the evidence sounds incredibly strong, every study has limitations. Are there any caveats we should keep in mind here?
Sure, like any large, complex study, there are a few things. It took a really long time to recruit all the patients, like 15 years.
Wow, okay.
And they actually ended up seeing fewer events, recurrences or deaths than they originally powered the study for. Though, importantly, the results were still statistically significant, still strong enough.
What about who's in the study? Does that affect how we interpret it?
That's a good point. They enrolled patients starting 2 to 6 months after they finished chemo. So anyone who had a very quick recurrence right after treatment ended probably wasn't included.
So the findings apply more to survivors who've gotten past that immediate post-chemo window.
Right. And we don't know from this study if starting exercise during chemo or even before surgery would have the same effect. That's still an open question.
And what about the intervention itself? Was it purely the exercise, or could the coaching and support have played a role on their own?
That's hard to untangle. The study tested the whole package. Structured exercise plus coaching. So you can't definitively say how much benefit came just from moving more versus the social contact, the accountability, the expert guidance.
It highlights that maybe the how the support is as important as what the exercise itself.
Quite possibly. It reflects the reality of behavior change. And one last minor point, maybe, how things were measured.
Go on.
Well, some of the data, like how much people actually exercised, relied on them telling the researchers self-report. And that can sometimes be, not perfectly accurate.
Sure. People might overestimate or forget.
Exactly. But importantly, those self-reports were backed up by objective measures of fitness and physical function, which did improve significantly in the exercise group. So there's concrete evidence supporting the activity levels.
Okay. So bringing it all together then, what's the absolute core message from this deep dive?
I think the core message is clear and honestly pretty exciting. This challenge trial gives us the highest quality evidence we have, a proper randomized controlled trial proving that a structured exercise program, started after chemo, significantly boosts both disease-free survival and overall survival for people who've had colon cancer. And the benefits are big enough to be genuinely comparable to standard drug treatments.
It really feels like a landmark finding. It moves exercise from just good advice into the realm of evidence-based medicine for cancer survivors.
Yeah.
So for you, the listener, hearing this level of really solid proof that something you can physically do, often pretty simply, can actually cause such a significant improvement in survival after a serious illness. What does that mean for how you think about the power or the importance of exercise, not just for general health, but maybe in recovery too?
And it's interesting, the study authors themselves point out that even with crystal clear evidence like this, getting patients to actually change their habits long term is still tough. They suggest that our health systems might need to step up and invest in the kind of support programs that worked in this trial.
Which leaves us with a really interesting final thought, doesn't it? The success story here wasn't just do more exercise. It was do more exercise within this structured, coached program with built-in support. So what does that tell us about what it really takes to bridge that gap between knowing something is incredibly good for us and actually doing it consistently, especially when facing big health challenges? Maybe the biggest hurdle isn't always the lack of evidence, but building the practical systems and human support needed to turn that powerful knowledge into sustainable, everyday action for cancer survivors, and maybe for all of us.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.